Welcome! In today's session, we'll explore techniques for dressing that foster independence and prioritize safety. These methods are vital in caregiving, ensuring both comfort and autonomy for our loved ones. To foster a safe environment for dressing, we must ensure that the patient is supported adequately while performing these tasks. This might mean different things for different people, but the goal is to ensure trunk support to allow the arms to complete dressing tasks. For our first demo, let's observe how a caregiver assists their patient with upper body dressing. The caregiver initiates the process by handing the shirt to the patient and allowing them to start the task by putting one arm in the shirt. Then the caregiver will pull the shirt over the back to allow for the other arm to be placed in the shirt. Buttoning up shirts can be challenging, especially for patients with impaired fine motor skills. As a caregiver, you may need to assist with buttoning if the patient requires help. Now let's incorporate a pullover shirt into our upper body dressing demonstration. Begin by laying the shirt face down on the patient's lap, then gather it together using both hands. Proceed to insert one arm at a time into the sleeve holes, ensuring the sleeves rest above the patient's elbow before pulling the shirt over the patient's head. Finally, use your thumb to hook the neck opening, pull it over the head, and smooth out the shirt over the torso. This technique can also be applied to a button-up shirt. Simply button it first and then position it similarly to the pullover shirt.
Okay.
Thank you.
You're welcome.
Now let's transition to dressing the lower extremities. Once you've ensured the patient is adequately supported, allow them to place the pants over each foot one at a time. If the patient is unable to do this independently, assist by placing each foot into the pants leg and pulling it up over the ankles.
You ready to stand up?
Here you can have the patient stand to complete the task if able. Be sure to hold the pants while the patient stands up so they do not fall. If the patient is unable to stand, have them lean to one side, pull the pants up over the opposite hip, and then repeat the process for the other side. This technique may require multiple leans to each side for full completion.
One more. Got it. Ready for socks and shoes?
Yeah.
Yep, okay.
Lastly, let's assist our patient with socks and shoes. Begin by rolling the sock in your hand. Gently stretch the sock to create an opening and place the sock over the foot. Use your thumb or finger to hook the sock on the bottom of the foot and pull it up over the heel. This technique is particularly useful when there is swelling in the feet. Alternatively, a sock aid can be used for independent donning, eliminating the need to bend down to the feet. For shoes, have the patient start things off by pulling the tongue of the shoe all the way toward the toes. This will create the largest opening possible. If the patient is able, a reacher can be used in placing shoes upright on the floor after securing the tongue of the shoe. Next, let the patient insert their toes into the shoe and start sliding the foot toward the toe. After placing the foot in the shoe, insert your finger into the heel to prevent it from collapsing. Then guide the patient to push their heel down into the shoe. A shoehorn can be employed for assistance, providing patients with the ability to independently hold the heel while putting on their shoes. Additionally, consider using elastic shoelaces. These offer increased stretch in the opening and eliminate the need for tying and untying. Enabling self-dressing goes beyond clothing. It's about preserving dignity and fostering independence. core elements of our care philosophy. By mastering these dressing techniques and incorporating adaptive equipment, we not only enhance daily living, but also ensure that our patients receive the best care while maximizing their independence.